Good afternoon, everybody, and thanks for joining us today. My name is Terry Lake. I'm the CEO of the BC Care Providers Association and EngAge BC. And I'd like to welcome you all here today for a very important virtual Care to Chat, a conversation with British Columbia's Health Minister, Adrian Dix. And at the outset, I'd like to acknowledge that many of our viewers are on the traditional territory of the Coast Salish First Nations, and I'm very proud to be on the traditional territory of the Secwepemc people here in the Kamloops region. I'd also like to thank our sponsors for this event, including our title sponsor, Rexall Health Solutions, our gold sponsor, Point Click Care, as well as our silver sponsors, Sobeys National Pharmacy Group and the Medical Pharmacies Group. All of their support has made our 7th season of Care to Chat, our series, very, very successful. So thank you to all of our sponsors. To date, as you know, most jurisdictions around the world, and British Columbia no exception, has been affected in some way by COVID-19. Particularly hard hit have been seniors, including those living in long-term care. And of course, many of those residents are increasingly frail and suffering from multiple chronic conditions. And so the government of British Columbia, of course, has mounted various coordinated actions, including the launching of Equip Care BC, additional funding and resources for personal protective equipment, the single site order, the visitation funding, the vaccinations that have made such a difference, and of course, increasing the human health resources in an attempt to mitigate the spread of COVID-19 in seniors' care. But despite this, and of course other actions in the long-term sector in Canada, we have been particularly hard hit, and over half of all fatalities in Canada have been in long-term care. But of course, there is a light at the end of the tunnel. We've seen that with the vaccination efforts that have been taking place over the last few months. And we've seen our guests today, Minister Dix, along with Dr. Bonnie Henry, at the forefront of the response here in British Columbia, briefing British Columbians almost every single day for over 15 months now. And so we're going to talk about the challenges that the minister has faced and talk a little bit about the future as well. And while our sponsor for the event will provide a more formal introduction, I want to say that I've had the pleasure of working with Adrian, not only as my role as a CEO of BC Care Providers and EngAge BC, but also, of course, as a colleague in the legislature. And so I want to say thank you to the minister for taking time out to be with us today. But with that, I want to introduce Scott Patterson, who will do a more formal introduction of the minister. Scott is from Rexall Health Solutions, and Scott's continuing care experience started in 2008 when he obtained his nursing license in Vancouver. He was then hired by Vancouver Coastal Health at Lionsgate Hospital, where all 3 of my daughters were born, by the way. Scott also worked with the float pool team within Lionsgate and has experience in general med surgery, first aid, emergency, ortho, neuro, hospice, and palliative wards. In 2015, Scott moved with his family to Calgary, where it's apparently 18 or so degrees today, but 10 degrees tomorrow. And he's also been a project lead for a year-long accreditation to bring the butterfly model of care to support those living with dementia. In November 2020, Scott joined Rexall Health Solutions as the customer care manager for Alberta and BC. So please join me in welcoming Scott Patterson from Rexall Health Solutions. Scott.
Terry, thank you very much for that warm introduction. I truly appreciate that. Good afternoon, everyone. Personally, I've followed this gentleman for many years and I'm a big fan. And on behalf of Rexall Health Solutions, it's my pleasure to introduce Honorable Adrian Dix, Minister of Health for Vancouver Kingsway. Adrian Dix was first elected as MLA for Vancouver Kingsway in 2005 and re-elected in 2009, 2013, and 2017. He's Minister of Health and Minister responsible for Francophone Affairs. Since being elected MLA for Vancouver Kingsway in 2005, Adrian has represented his constituents and their concerns, advocating for children in care, seniors, treatment of workers, and public health research. Adrian served as leader of the official opposition from 2011 to 2014. During this time, he proposed a BC-wide colorectal cancer screening program, insulin pump coverage for young adults, and lower generic drug prices, all of which became provincial policy. Prior to becoming an MLA, Adrian was the executive director for BC Yukon branch of Canadian Parents for French, a nonprofit organization promoting language education. From 2001 to 2005, Adrian was a political commentator and journalist, writing a column for the Victoria Times Columnist and The Source, a multicultural newspaper in Vancouver. From 1996 to 1999, he was the chief of staff to former BC Premier Glenn Clark. Adrian was raised in Vancouver and is a UBC graduate, and he's married to award-winning poet and writer Renee Saklakar. Over to you, Minister.
Well, thank you very much, and thank you all for joining me today. Thank you for that very kind introduction. Thanks, of course, to Terry and the care providers, to Rexall for making this this event possible today. I think one of the things that I reflect on over the last year is the extent to which all of us, from people who work in healthcare, such as Scott, to leaders of organizations, be they industry organizations or labor organizations, be they members of the opposition, how well people have worked together in British Columbia. Sometimes I think we don't look across the country as much as we might, or around the world. But here, the degree of consensus, not to say it's perfect, but the degree of consensus and working together, the Team BC approach, I think, has made BC has been a big part of British Columbia's success in dealing with the COVID-19 pandemic relative to other jurisdictions, and has, I think, demonstrated overall both the strength of our health systems and the strength of BC society. And so I'm very appreciative. I'm very appreciative to all of you, the BC care providers who make such a difference in the lives of seniors in long-term care and assisted living in the community every day. I'm always delighted to see Terry, because he reminds me he's looking, I think, pretty relaxed in Kamloops there. He reminds me that life can be good after you're Minister of Health, which gives me something to look forward to. I wanted to talk a little bit about the COVID-19 pandemic. We're going to have, I think, an opportunity to have a dialogue to answer some of the specific questions about programs and about the future. But I wanted to talk about how we work together in this pandemic and what I hope it means for the future of care in British Columbia. Prior to the pandemic, I think, and from 2017 on, and none of this is inevitable. It requires, I think, cooperation and generosity on all sides. I think we've developed an extremely good relationship between the new NDP government, which hadn't been in power for a long time, and the BC Care Providers Association, but also Denominational Health, working also on the labor side to work together on problems. And whether that was the funding through the EQIP program, or our significant effort to raise care standards across BC, which was backed up with dollars, and most of which went to support public beds in private, for-profit and non-for-profit care homes. I think that made a real difference. We built over time by resolving problems, by working together, both with our teams in the Ministry of Health and the health authorities, with leadership, Terry now, and prior to that, Daniel and his team, and doing that, and I think resolving problems before they became public disputes, improving care standards together. I think we developed a good relationship, and that relationship has stood us in good stead when we face this unprecedented challenge of the COVID-19 pandemic. The increases in the training, the advocacy at the national and provincial level of care providers and of others in the sector has been extraordinarily helpful, I think, to British Columbia, and our own efforts to do that together. So at the beginning of the pandemic, we were, I think, in a very good place, and that put us in good stead. And when you compare that with other jurisdictions in Canada, and the relationships and the working relationships between government and the sector, I think that part of that, there's a significant underlying rationale for why we did relatively well, especially initially in the pandemic. The steps we take, you all know, and I won't repeat them at length, but the access to PPE, the support for the direct support to care providers to provide, to purchase equipment to support them, the direct funding care homes, the single site act, the single site policy, which provides an assistance not without extraordinary challenges in putting it in place, but one that was backed up with the financial resources required to do that. And all of the other measures that we've taken together over time to support infection control have had, I think, a positive effect. Now, all of that said, you know it because you live it. I know it because we live this every day. And I think it's important to reflect on this now because, of course, the center of the COVID-19 pandemic in the last little while, at least in public attention, has been, sometimes on things that occur, like pop-up clinics in Surrey, or the events in Whistler, or events in particular communities such as Prince Rupert. It has moved away from long-term care in the last month or two as we moved to vaccinate more than 40,000 workers in long-term care, and of course, well over 90% of residents in long-term care and assisted living. And the number of outbreaks, currently I believe is 7, has gone down significantly, and it has gone away from the center of the COVID-19 discussion. But it's only been a couple of months, and we all know what happened here, which is people passing away in the hundreds. And we grieve them today, and I know that you and your staff and everyone who lost someone in a care home grieves those that they've lost. And the fact that we've done better than other jurisdictions, that our mortality rate is less than half the national average from COVID-19 in BC, and that all the comparable provinces, the provinces west of the Maritimes, BC's record in long-term care is the best, doesn't take away from the fact that this was brutal in long-term care. The consequences for residents of the isolation and the limitations in visitation, and the impact of outbreaks on staff, on leadership, and in particular on residents and family and long-term care, is something that we can never forget, that we have to learn the lessons from, and that we have to continue to acknowledge and move as we move forward from that. And there will be a desire once the pandemic is under more control to move forward. There'll be a desire for a lot of people to move forward. We have to continue to maintain the momentum together to make improvements in the quality of life in long-term care. And I'm committed to do that. You know that the programs that have been set in place, the various programs that were amongst the 7,000 positions that we intended to hire at present, I believe that number is approximately 3,000 people hired based on those programs in the first year. It's an impressive start. And we have to continue to do that work in terms of increasing the number of spaces. And you saw that reflected with money and with supports in the budget. And I think we have to reflect on some of the most important and challenging questions in long-term care, which is all of our steps, all of our actions are focused on making people safer in long-term care. And that's important. Don't get me wrong, it's not a question of undermining safety in long-term care, but the absolute need for us to continue to improve the quality of life. So what does that mean? That means, of course, recruiting staff and the staffing required, but also looking at our relationships to see how we can raise not just care standards in the sense of staffing, but the quality of life in long-term care, how we can make the investments required so that people are not just living longer in long-term care, which they are, but living better. And that is a fundamental challenge, I think, for our system. And reflecting on, frankly, the significant growth we're going to see in the numbers of seniors, the need, therefore, to support community programs to allow people to live at home as long as possible and to give people more flexibility in terms of their ability to stay at home and stay out of long-term care, which we'll need with growing numbers of people, because inevitably with the increase in the number of seniors, we will not be able to increase the number of beds at that speed, or we may not be able to. So to do so, we have to improved care in the community, improve people's capacity and their liberty and their freedom to express themselves and to stay in the community as long as possible. And then when they get in long-term care, to continue within the constraints of long-term care. The fact that everybody in long-term care has serious physical and sometimes mental health challenges that they face, we have to continue to focus on that. So what are we doing? As you can tell, we're building more long-term care homes, and it's the most significant, and it's a mixed approach in the sense that in the Interior Health Authority, as you'll know, 495 new beds. They're your members, with the exception of Nelson. Will be your members for the most part, the BC care providers or denominational health. In those new beds in the Interior Health Authority, which is the largest single RFP they've ever done in interior health, and in the public side of the system in particular, but also I would argue the nonprofit side, we have to start making the capital investments. People often talk about building new beds, but we know, especially in the public system, the vast majority of multi-bedrooms are in the public system. We need to make the capital investment there. So this is fundamental. We have, I think, momentum. We have public support for investments in long-term care, improving the standards. We have a whole community of families, which is more than bruised, but recovering from a year that has been brutal for everybody involved in the sector. The pandemic has exposed the challenges of long-term care, and we have to respond to that and continue to take advantage of that and build on that, and do so, I think, in the same way that we handled the pandemic in British Columbia, which is to do so with a Team BC approach, working together, government, business, unions, people working in it, families, residents themselves, in order to improve the quality of care. I think that is the best and most appropriate response to this extraordinarily difficult year. I thank you for all your support, and I look forward to talking about these issues in detail as we do some Q&A. Now, Terry and I have only had the experience of doing Q&A in reverse. He was the Minister of Health in British Columbia, as you know, and I occasionally asked him questions, always fair and thoughtful and restrained questions, if I recall correctly. But cognitive dissonance being what it is, Terry, you may recall it differently. In any event, this is Terry's opportunity to ask the questions, my opportunity to answer it, and I look forward to doing so, and thank you all for joining us today.
Well, thank you very much, Minister, and we will appreciate no heckling from the audience as we engage in our discussion. Adrian, you know that people on the front lines have been working tremendously hard for over 14 months. They're worn out, but nobody has been, more in the forefront than you and Dr. Henry. So, on a personal level, how are you doing?
I'm doing really well. I hate to admit this, Terry, but my wife Renee Sackar and I are kind of introverts. So in some ways, this hasn't changed our lives very much, which is a good thing. We love each other's company, but spending the evening in our tight little bubble has not been too bad. And our personal relationship is always strong, has never been stronger, and I feel genuinely supported and loved in my personal life, and in my professional life, genuinely supported. And I think, including by many of the members on your phone, my friend Ali Debfu, has been consistently and personally supportive. And I think that's one of the things that's helped us get through. And so it is, I think British Columbians are a little bit tired of hearing from me. And I hope in the next year to get less media and to be less in the public eye. I think everyone would like that. But for the moment, we're right in the middle of it still. There's a lot of cases now. We're really concerned. And as health leaders, all of the people here, I just want to encourage people to register and get vaccinated. That we got a lot of people registered, 2 million people, but not enough. And all of you are leaders in your communities, and whether it's in your personal networks or through social media, we really need people to get vaccinated. Because I think once we reach that point, we can start making the changes we really need to make. But I'm doing unusually well, and I feel privileged. I want to say something briefly about Dr. Henry, because I think you'll understand this. I think people on the phone who are women leaders in healthcare will understand this. Dr. Henry and I both in the public eye, and I, of course, get more than my share of negative emails and so on. But Dr. Henry is also genuinely admired in BC, and her polling numbers are something that are astonishing. I think she has massive support, but she's also been, because she's a woman leader, been the target of totally unacceptable actions. And she has, I think, come through that. You know her personally, Terry, you worked with Bonnie, you know what a person he is, but this is a person of such quality. And I think that what we have to try and do as a society better is to be able to disagree without personal attacks. And I've tried to model that. I know you have a little bit. Tried to model that to try and distinguish the issues from people sometimes, but Bonnie's been magnificent, and she deserves all the credit she's received.
Well, you can tell her from all of our members, and I'm sure everyone on this call today, that we appreciate her efforts and her commitment, as well as yours, because you are doing remarkably well. I know the pressure you must be under, because COVID, of course, is just one file, and in health there are many, many files, and it does wear you down. So we're really glad that you could take the time today, and I'm glad that you are in good spirits, because we need you there and working for all of us. Adrian, when I was in health, we recognized that there was a health human resources challenge in front of us. I would argue that despite knowing that, we tended to be sort of second fiddle to the tech sector and sometimes the natural resource sector in terms of labor market strategies. Do you think that past governments and current governments should have been doing more to address the health human resources challenges? And I don't mean just in BC, because it's across the country.
Yes, I think that's absolutely true, just in a general sense across the country. I think sometimes some of these debates too are, we get stuck on other issues. I think we look at issues such as immigration, giving people opportunity to come to this country and work in our health sector and do well and contribute as citizens. This is something we should celebrate. And sometimes I think in politics, the debate about immigration ignores the extraordinary benefits that immigration brings to us, and that we have to, as leaders, come together to make the case for immigration in a general sense, because it's one part of the solution. It is one part of the solution, having people come here who are qualified, who want to come here, who live here, or rejoin their families and work in healthcare. This is something we need right now. And so we got to be leaders on that question. And on the training question, absolutely. I think and this isn't a political question, I think this is across party lines on training in general. A lot of the training that everyone want to focus on, the photo op people want to focus on, is often in the trades or other kind of training and not healthcare. And these are where jobs are available. And I'll just say one particular thing that's the indication of this. Indigenous people in our province are relatively underrepresented as healthcare workers. And this raises issues. We're in the process of dealing with racism in the healthcare system. And that's one set of issues, representation important. But you look at a community such as Fort St. James, a community where we're going to have a massive increase in the number of seniors in the next little while. As communities such as Fort St. James, say 187% increase in the number of seniors. If we don't reach out and have people working in Indigenous people joining our health workforce, that is who the young people are in that community. It's an opportunity for people to have a future and opportunity in community, and we've got to make it happen. So I think you're absolutely right. This has got to be a provincial mission on our part to build the next generation of healthcare workers. Disproportionately, our healthcare workers are over 50 as a share of the population, and they are exhausted right now. And so we've got to do everything we can as we come out of the pandemic to recognize and in a way reward and respond to that exhaustion, both through program support and other things, but also to take this opportunity to hire more people. Now we're doing that, and we're seeing that work out in the programs we're seeing, but the demand, as you know, is enormous. So this is where we need to speak with one voice and say, healthcare is where young people have enormous opportunities to do, to have fulfilling lives and careers, and we've got to make it possible for that to happen at every level. And the care providers have been leaders of this at the post-secondary education level and advancing that. And we got to advance those programs. We've got to increase spaces as we are, and we got to work with the federal government on a national strategy that really responds to it. Because the only thing really limiting us in healthcare, there's always the issue of money, but money's a political question, right? And you can have that debate. What we need to have, though, it seems to me, the real thing limiting anything we want to do in healthcare is human resources. And this is an opportunity for tens of thousands of people. But if we don't deal with it now, it takes a long time to train a nurse, longer to train a doctor, long time to train a nurse practitioner, but important to train care aides and everyone else in healthcare. If we don't do it, we're going to find ourselves in trouble. We are in a little trouble now. We'll find ourselves in a lot of trouble soon.
Thank you for that, Minister. And I know you're having some video issues that were there before. I'm not sure if you're going to get them worked out, but that's okay. We know that healthcare and technology sometimes don't intersect very well. It was one of the biggest pains in the ministry when I was there. And I'm glad you mentioned healthcare aides. We graduated through Discovery College, 3 cohorts yesterday, and it brings tears to your eyes to see the dedication and passion that these folks have when they get their training done. So really thank you for the support there. Now, getting back to the public health aspects of it, you mentioned Dr. Henry and the great work she's doing, and no one would certainly challenge her expertise in public health. That's well recognized across the country. But seniors care is, an entity unto itself. It is very specialized, and there have been some concerns, I guess, expressed in the sector that the public health office has not been as well connected to the sector as it could be. And so I'm wondering if you have any comments about that, if there was any consideration to having, for instance, the Office of the Seniors Advocate and the PHO working together in concert to lend the expertise of seniors care and tie it in with public health. Was that ever a consideration or something that we could continue to work on in the future?
Yeah, I think we did, as people will know, at the beginning of the pandemic. And yeah, I'm having some technology problems. I'm on my 3rd machine now, Terry, but we're going to keep going. We're going to keep going. I'm not going to be deterred by this. I think what we did at the beginning of the pandemic, as you recall, is we opened up the United Way program. $50 million we put into that. And we essentially put Isabel McKenzie in charge. And in charge with a committee that included colleagues of mine in the legislature, Janet Rutledge, but also Shirley Bond, Sonia Firstino, who worked together to deliver services in communities. So we worked to give the seniors advocate a significant role. And I think coming out of that, I think personally, and the care providers deserve credit for this too, we rebuilt some of the strong relationships between the seniors advocate and the sector. We had a period where there were, to be frank, there was an exchange of views, and Isabel McKenzie, because you worked with her for 4 years, and you know that if you're going to have a seniors advocate, they're going to criticize you as a minister from time to time and as a sector from time to time. But I think the sector's done a relatively good job of building on that relationship, and there is a role for the seniors advocate. I think directly with respect to government, I think I heard the criticism. And one of the reasons why the Ministry of Health did the much discussed Ernst & Young report was to deal with those issues between the ministry and the sector to see what we could do to improve them. And then we made some improvements based on that. I think the criticism may be legitimate, but it also, compared to other jurisdictions, I would say, the performance of our Deputy Minister, Steve Brown, in working with the sector, our team of ADMs led by Terry Collins, the involvement of Isabel McKenzie and the health authority teams has actually been quite good. I acknowledge that it can always be better, and we can always work things out more quickly. But when you consider the stakes and the circumstances, I think the relationships stayed strong. And compared to other jurisdictions where there is nothing but finger pointing, well, people were dying. There was finger pointing in other jurisdictions. I don't want to be critical of anyone in particular in that, but we saw this as we saw the national coverage of long-term care. Here we saw a thoughtful, caring, mature sector working with a government that was trying. We could have done it better, and there are lessons to be learned from that, and we're trying to learn those lessons. But compared to other places, I think the sector, and this is credit is shared here, the sector did very well, and I think we did well.
I'd agree with a lot of those comments. I think we have been the model across the country, and knowing that we didn't get it perfect, but I do think the response here has been better than most. One of the first things that was done was the single site order, and that makes perfect sense. You don't want people taking the virus from one home to another home to another home. But of course, there are challenges with the single site order. It's very difficult to work your human resources, scheduling, vacations, sick time with the single site order in place, because it's just not a casual pool there to pull from. With vaccination being so successful in the sector, is it time to reflect and review what that single site order looks like? Is there an opportunity to revise it in some way to ease the pressure on the staffing challenges that the sector has?
I think that I'll tell you what I expect. I expect us to continue with the single site order for some time, and that to build it into our work together as we envision the future of long-term care. So that will become part of it. I think in the long term, the single site order is going to help us with human resources, because it's going to make jobs better, the quality of work better, and the consistency of work better. But that doesn't mean you build a system based on another labor model, which included a large casual pool, and the transition is going to be hard. I think you reflect that in your discussion of it, and not just for private, not-for-profit care providers, but for everybody, for the public system as well, because people are working in different places, sometimes because they had to, and sometimes because that was a desirable result. But creating permanent positions is going to allow us to recruit in the long run. I think we can link it to human resources, the fact that it was strongly funded and supported. And I expect the single site vision of the province and the province in long-term care to continue, not without its challenges. And we'll absolutely talk to you and the care providers and denominational health and everyone about what those challenges are and how we can address them. But I think that it will underpin an effective human resource strategy, as well as one that will make healthcare facilities safer. And those relationships, those permanent relationships that come with permanent staff who are not moving around a lot, multiple sites, they make life better in long-term care. And I think we acknowledge that. I think it's one of the lessons of the pandemic. But let's acknowledge that it's not easy, that you build a system based on a more flexible labor circumstance, and then it changes, and it doesn't change over a year, but it changes over a period of weeks. That was always going to be a challenge. I think people responded very well, and we're very committed to it financially and in every other way. And the fact that so many workers were affected and moved and did so relatively seamlessly in a pandemic when everybody was under pressure is a real tribute to everyone involved. And so I hear the concerns, but I think you can expect us to continue with the single site approach, I believe, for years into the future.
One of the results of the spotlight on long-term care across the country has been a deeper interest on the part of the federal government to be involved in seniors care. You and I both know that there's always these jurisdictional disputes. Currently, the federal government spends about or pays for about 25% of health budgets across the country. There's a big argument to be made that that's not enough. In 2017, when we negotiated the health funding agreement, there was a separate tranche for home and community care, which was a way of the federal government putting money in and getting some of their objectives met. Now we see them approaching long-term care with national standards, $3 billion over 5 years. But of course, that's going to depend on provinces and territories coming to the table and being willing participants. What's your view on national standards, and will British Columbia engage with the federal government to take advantage of this interest on the part of Ottawa?
I think the short answer to that is yes. I would say, but it just shows $3 billion, over 5 years. You'd be familiar with this as Minister of Health. Thinks over 100 years, that would be a lot more, I think, probably. $3 billion over 5 years is basically $65 billion a year for British Columbia. Right? And in the context of the health budget and what we spend on long-term care, I would never say no to that. But I think if you're talking about the raising of national standards in terms of staffing and long-term care, the federal government will have to come to the table with more than that. And I think everyone understands that. So I'm open to talking about anything that improves care standards and that gets them involved and gets long-term funding from BC. Of course, it's my position, and I think it was your position as Minister of Health, that the best way to do that is through the Canada Health Transfer. And BC and the Premier of the day, Christy Clark, and you, when they changed that model under Mr. Harper's government in 2014, when they changed the formula in a way that disadvantaged BC, because it didn't reflect on the number of seniors here, the demographic conditions here, they changed the formula. BC objected profoundly then, and that decision was made, as you'll remember, without real consultation by the government. They just made it. And BC, it's cost BC significantly, both under the previous government and under our government. I think the best way to do that is through the Canada Health Transfer, but I'm not stuck on things. Like, I think we have to work through these problems. The federal government talks a lot about things, national pharmacare, their proposals for national dental care, now increases in national long-term care standards. But I think these discussions need to be, especially at this point in the occasion, really frank. If we want to raise care standards, if that's the goal, then the federal government, which currently contributes 22-23%, simply has to raise that. And I'm prepared, any day of the week, Sunday night, Monday morning. Our last federal provincial meeting on health started at 6 a.m. BC time, any time of day, to sit down with them, if we can take some steps to improve long-term care and provide permanent funding, to talk about any of those things. I'm not worried about the jurisdictional question, but I am worried about the need to advance long-term care. But I think you pointed to something earlier where I think the federal government can play a role, and that is on health human resources. I think they have a critical role to play, as do the care providers and others, in that question. That's a fundamental question for the future that goes beyond the debate about money in these questions. And the federal government needs to play a role in that. And they haven't really in a serious way over time. And they need to play a role now. And again, if they want to play a role, they want to share, I'm happy to share, as long as we make progress for people.
Thanks for that. The BC model of care is quite different from those across Canada, in that we have a sort of an even one-third mix of owned and operated through health authorities, not-for-profit providers, and for-profit providers. And I think we would all agree that generally it's worked quite well. Our members, of course, are both not-for-profit and for-profit, and there feels like a bit of a mixed message on for-profit care. We see, in Ontario, obviously, there's been a lot of negative press about for-profit, particularly in the first wave, not so much in the second wave. Your government in the election and through the budget, the signals are that there's going to continue to be a role for profit, but that the emphasis will be on owned and operated and not-for-profits. Can you give some clarity around that to our membership today about the role of for-profit providers in British Columbia?
Okay, I'm going to give a long answer, Terry, which is just about every other answer, but I'll give a long answer. It's a good question. I think the first thing is to look at the sector and what the elements of the sector need. There's a capital question that's a question for health authority owned and operated. And if I would be critical of the previous government in this regard, I'd say that we didn't invest enough in those in health authority owned and operated. In the existing beds, right, many of which are too old. You look at Evergreen, you look at the ones on the Sunshine Coast, you look at in Kamloops, right? You have healthcare facilities that are health authority owned and operated that we need and we must use that do not meet current standards. And we have to do something about that. And that's the most frustrating part. It's like seismic upgrading in education, right? You know, like you're not immediately improving services. We gotta spend in the billions to replace existing beds in the health authority owned and operated system. And so when you look at what we're offering, proposing on capital, it's exactly that. I mean, my mother-in-law is in a health authority owned and operated care home, and she's in a multi-bedroom, right? And we want to move towards single bedrooms. And if you're going to address that problem, principally you're addressing that problem in the health authority owned and operated system, and to a degree in the not-for-profit system, where there's some older care homes. So that's point one, that you have to address that. When people say, if I had $1 billion, would I buy the largest care home operator in the province? One of them, the largest one, I think, sold Retirement Concepts when you were Minister of Health for $700-800 million, right? Or would I spend that money to replace and expand public care homes? It's clearly the latter. It's clearly the latter. I hear the debate about going to a public-only system, but people have to be frank about and straightforward, I think, in that debate about the costs and what they're prepared to do and not do. Because if we acknowledge that we're going to spend more on healthcare and that we need to spend billions in these areas, I want to improve care for people. So on the public side, my focus is on improving the quality of care and the capital infrastructure of our public facilities, whether in Chilliwack or in Abbotsford or anywhere else. We have to do that, and we put that off a little too long. On the not-for-profit side, there's also a small capital problem, and a lot of your members will know this. And it's a significant problem, I think, that we need to support them with, because a number of major not-for-profit facilities require capital upgrades, and some of those organizations, and I don't want to overstate this, you can generalize, we have not-for-profits that have been buying for-profit homes, right? So we've got some powerhouse access to capital not-for-profits in our province, so we have to do that. So there's that. And then on the for-profit side, we've got to continue to engage and improve the relationship. I sense that the current 1/3, 1/3, 1/3 is going to stay pretty consistent, right? And that we have to do everything we can to improve the quality of care, involve BC Housing. But there's a broader debate. And because BC, and everyone on the phone will notice this, it has a crazy real estate market. And we have to, in this city of Vancouver, where we have to add beds, to do so, to purchase property, to work together to maintain the current sector, when the advantages sometimes of moving to other forms of real estate development are so large, we have to work together to expand the sector and provide access. So I think we've got to double down on the approach we took in the pandemic, which is a Team BC approach, to acknowledge that everyone has a role, to acknowledge that there are challenges for each portion of the sector, and to work and to be laser focused about dealing with that. Because on the capital side, everyone's under pressure. The not-for-profits will be under pressure, the for-profits will be under pressure, because there's always investors who will argue for a better use of land, right? And we have some very large sites where you could see that happening, and we can't have that happen. The cost of we're doing 495 beds in interior health. Well, if a major provider who provides 250 beds now were able to pull out or give notice and not give access to care, well, half of those beds could be gone, right? So these are such significant issues that I think we got to work together as a sector. So we're going to be investing. We're going to be investing in more staff. We believe in the single site order and that model of ensuring that everyone who works in the sector earns a living wage. But we also think that the major task right now in the public side, the health authority owned and operated side, is to deal with our capital infrastructure. That's where the multi-bedrooms are. That's where the old facilities are. And that's why you see in the budget an emphasis on remediation, replacement, and improvement and expansion of those beds. But I think we need to do it all.
Thank you, and I appreciate the response. And I know our members, through that rebuilding of the owned and operated, of course, there will be opportunities through decanting that will have to take place when they're being rebuilt. Something that is maybe a BC kind of approach, more so than Alberta and Ontario, is independent living and family retained home health services don't receive any government support. And yet it's well recognized that they tend to keep people in the community longer because the buildings are purpose built and you don't have falls, as many falls and reasons to sort of have people go up the continuum of care. Has there been any sort of thought about support for this part of the sector as we've seen in Alberta and Ontario?
There is. I mean, I think it's a broader question. You know, I'm affected by the idea that when public health there came to Canada, the average life expectancy was 70, 71, and it was obviously longer than that. Life expectancy at 65 was probably 13 or 14. Now life expectancy at 65 is basically 24. So when we talk about seniors as if they're one group of people, of course they're immensely diverse and their needs are immensely diverse. And one of the things I'm proudest of, and this was inspired by Isabel McKenzie, who advised on this, is the investment we've made in respite care in the last number of years, in community respite care, the dramatic increase in adult day programs, the support and the increase in home support, which was helped by the federal government and other areas, because we have to do all of those things. We have to think about ways and means for people to access their own investments to support not care, but their quality of life, I think, in community. And there's some good ideas as to how we might do this, so that you know, we have many circumstances in this city. I'm in a below average income riding, where basically the price of a house is beyond me, and I'm paid as a cabinet minister in BC, right? The average cost of a house in my constituency is $1.3 million. And so how do we find ways for people to live well in their retiring years, access their own capital in those years to live well? And those are things that we have to think about. In terms of independent living, absolutely. I think our target right now would be to expand assisted living, which is its own category of care, and which is, I would say, we've underinvested in over time, including under our government. We've done some things and improved some funding, but it's an area. And independent living is something absolutely to look at it as well. How do you find the ways and means, given the extraordinary costs that are coming in long-term care and in assisted living, to allow seniors to access independent living? And it may not just be on the direct government subsidy side, but allow seniors to access their own resources better, so that they can live that retirement in a better way. Those are choices seniors are always going to make. I remember working for the Minister of Finance, Terry, about 20 years ago, and being on the phone with people who would say to me, I'd say, well, you know, there's this property tax deferment thing. And they were, even though it was in their interest to do it, and they could have done it, they were totally against the idea of doing it. So I don't want to say that we'd be making those decisions for seniors, but I think we have to provide seniors with more ability to use their own resources in those times. And that may involve, and we need to think about how we use the tax system and other things to do that, how we use that to allow people to use them as well, because we've got to have a lot more seniors, and we want them to have the freedom and liberty to make a whole bunch of choices, including independent living.
Well, thanks, and you'll be happy to know that I am taking advantage of the property tax deferral system. We're running out of time quickly because it's been such a great discussion. But I do want to finish off talking about vaccinations. It's made such a remarkable difference in long-term care, as we've seen. But we've reached a point where you know, the uptake was generally good among staff. As you mentioned, residents, extremely good, but there are still some homes where staff are reluctant. And we have our members reporting that unvaccinated staff are testing positive. One, by the way, caught with a rapid test. That's for another day. We'll be talking about that. But is there, you know, when I was minister, we had a mandatory vaccine or mask mandate for flu. That has gone by the wayside, and there doesn't appear to be any momentum for a vaccination and or testing, you know, regular testing protocol for workers on the front lines. And I'd like to hear from you on that issue.
We feel, and I feel, that mandatory vaccination is not the way to go. I understand as an argument how people would be very sympathetic to that. But how can you allow that to happen, people will say. But I think the most effective way of dealing with vaccination, I felt that in 2019 with the measles, when we had a measles outbreak amongst young people in BC, and I feel that now, is to absolutely maximize the voluntary vaccination of people. And that's what we're going to continue to do. In long-term care, that's been over 40,000 long-term care workers, over 30,000 residents, and it's obviously been very effective. We have had, and this is the case, both unvaccinated staff get sick and unvaccinated residents of facilities get sick in the last month or two, a small number. And what that reminds us of is the need to put other measures in place to continue to protect people. So I don't expect that to change. In these areas, some of these areas, we follow Dr. Henry's advice. She's strongly of the view that we're not going to go to mandatory vaccination, but we have to do absolutely everything we can. And this is where the next couple of months are going to be crucial, I think. If you think of the vaccination rate, it is kind of a universal thing. We've achieved sort of community immunity in long-term care, more or less, in assisted living, more or less, and some other sectors, more or less. But this is where, but up to now, we've had relative scarcity of vaccine. We're up to 39% today of adults vaccinated, of eligible people vaccinated. But we're going to have to collectively, I think, make the case and to continue to push to get people to vaccinate, that last group of people to vaccinate. And I think the evidence of these extraordinary vaccines that have been produced, especially the mRNA vaccine, there's a lot of debate about AstraZeneca. It's a very successful vaccine as well. But these are the most successful vaccines we have ever seen in human history. They have had a profound effect, very few what are called APHEs or adverse events. I think now, anyone who was reluctant at the beginning, because they were the first people to try a new vaccine, we have to find ways to get back to them and do that. And the good thing about it is we're about to go through and vaccinate the remainder of long-term care. We did about 72% second doses amongst those staff and residents when we changed the interval between second doses. As we go back to every care home in BC and finish off second doses, this is our opportunity to get back and do the remainder of first doses. And I think part of our planning is to see that we do that, to engage with everybody. Well, because we're going to be there doing second doses with everybody and continuing to do doses as new people enter the sector. We have to make this our chance, our launching pad, to make sure that we get as close to total vaccination as we can get.
Thank you, Minister. I really appreciate your candidness today, the time, because we know how busy you are. And I must say this conversation was less reminiscent of our question period exchanges, more reminiscent of our hallway exchanges.
Yeah, I think so. I think so. You know, a question period is its own thing, but, you know, I think that, you know, one of the things I've tried to do, and I know you tried to do, especially in our hallway exchanges, what I think we need to try and do at BC is continue to build on the working together. And it's hard. I mean, because politics is the exchange of ideas, there is a certain marketplace of idea and competition. But we have, and I encourage you to meet her, a very, very good new health critic in BC, Renee Merrifield, who's the health critic for the Liberal Party. Sonia Furstenau, I think, still has that role and is leader of the Green Party. Worked very closely with Norm Letnick, as other Mike Bernier, who are just outstanding people who've been excellent health critics in this province. And I think we got to find ways to have these discussions together, because in long-term care, the Team BC approach has to be broader. And Shirley Bond, as you know, is now the critic for seniors care in BC. And I worked very closely and very well with Shirley during the pandemic. She was very involved in the first days, especially developing our in-community seniors plan. I think we got to find ways to have these discussions and to have a united BC view in long-term care. I think will be effective in Ottawa, but effective in general if we keep going in this direction. Absolutely.
I want to thank you once again, and also as we wrap up, thank our sponsors, Rexall Health Solutions, of course, our title sponsor, gold sponsors, Point Click Care, and our silver sponsor, Sobeys National Pharmacy Group and the Medical Pharmacies Group. It's our final Care to Chat for the season. It's been a great season, virtual as it is, but I want to thank Kathy Schmaz and her team for tremendous work making these so successful. We will have a couple of more events for you to attend over the next little while. We're having, I mentioned, a mandatory vaccination discussion on May 12th as a lunch and learn, so please join us for that. We're having one May 6th on rapid testing with the PHSA, and we've got one more coming up on the insurance issues around the challenge of insurance coming up as well. But I'd like to remind everyone about our conference, the 3 R's: reflection, resilience, and reinvention. That's coming up at the end of this month, so please check our website and register for that. There's still the early bird registration, so please take advantage of that. And we'll have Andre Picard. He and I will have a great dialogue on his book, Neglected No More, about the future of long-term care in Canada. So once again, thank you, Minister. Thank you, everybody, for participating today. And we hope you have a great rest of a Friday and a very restful and enjoyable weekend. Thanks, everybody.